Last week, I posted this statistic across all of my social media platforms, and I was shocked at the response that I got. The statistic itself is pretty shocking that 60% of the counties in the United States do not have a urologist, that actually there's a shortage of urologists in the United States. And so I simply asked, how far do you have to travel for your treatment as a bladder cancer patient? Across all of my platforms, I got about 125 responses, and it was interesting to see that some people quantified the distance that they traveled in miles and some in time. Some of the most common answers seem to range between about an hour and a half to 2.5 hour commute to and from the urologist, either for appointments or treatments or both. I wanted to declare a winner, but I had a really hard time deciding between this patient who travels 840 miles to treatment and this patient who quantified theirs as 7.5 hours each way. This commenter noted that there are many counties in their state, and they were referred by their oncologist to travel 9.5 hours to get the treatment that they wanted. But this was a common thread that I saw, that some people did have urologists in their area, but they opted to travel further to get better care. Some of the commenters brought up the cost of bladder cancer and that traveling to and from these treatments such long distances have added to the costs of bladder cancer, which is already one of the most expensive cancers for a patient to treat. There's this patient who travels 3 hours each way, and her family has actually discussed the possibility of getting an apartment in the city where she receives treatment to make things more convenient, but they also noted that in this economy, that's really not the best option for them. Because I live in a large metropolitan area, access to care wasn't a factor that I really considered. But this was a really eye-opening experience to put this data piece out there and get these responses from people that live in other areas who have different circumstances. It is, again, another reason why we need to continue to raise awareness for bladder cancer.